My name is Dusty, and I was diagnosed with NET in June of 2022. Today, I'd like to share a little bit with you about what has helped me through my newly diagnosed journey. There are some moments of this journey that play like a movie in my mind. I can remember getting off the phone the day my family doctor called to tell me that an ultrasound ordered for some mild abdominal pain appeared to show multiple tumors throughout my abdomen, likely indicating stage 4 cancer. There are many things, tools, resources, and people that have been vital to navigating this journey, but that first day, the first thing I turned to was faith. When I got off that call, I fell to my knees and cried out to God, and all I could say to him over and over again was, "It's not enough time." My faith has been such a source of hope and strength throughout this journey. It has allowed me to feel unexplainable peace, have the courage to tackle the parts of this that are within my control, and rest and trust with the parts that are outside of my control. Like many people with NET, I spent the first few weeks after my initial tumor diagnosis believing I had some much more aggressive forms of cancer with much more grim prognoses. Thoughts of my family and my 2 young daughters, who were age 4 and 7 at the time, dominated my thoughts. However, I just kept praying for enough time. Weeks after that first ultrasound, a local surgeon who was involved in my care called me to discuss my biopsy results. When he called, he said, "You have what are called neuroendocrine tumors. I think this is good news. It may still be cancer, but I'm not sure. I've never seen this in person before. Your oncologist will be able to tell you more." That evening, I would scour the internet for answers. Thankfully, I was met by an amazing array of new patient resources from various NET research, education, and advocacy organizations, such as LACNETS, NetRF, INCAN, Healing Net Foundation, Carcinoid Foundation, and more. I finally went to bed around 4 a.m. with a surprisingly clear initial grasp of what this disease may entail. The resources available empowered me with knowledge to be my own advocate. Most importantly, those resources gave me hope. At the end of that initial evening of research, I realized that my prayers for enough time might actually be very feasible. One of the first people I connected with in the NET community was Lisa Yen from LACNETS. She helped me learn to define my own priorities as a patient. She helped me find lists of doctors who were NET experts. She connected me with research that was pertinent to my own particular type of neuroendocrine tumor. And she gave me so much encouragement through connecting me with NET mentors, patient support groups, and more. I'm very blessed to have wonderful insurance, and so I was able to visit some of the most renowned NET experts in the country, including Dr. Hal, Dylan, and Chandrika at the University of Iowa, Dr. Pommier at OHSU, Dr. Anthony at the University of Kentucky, Dr. Halprin at MD Anderson, Dr. Liu at Rocky Mountain Cancer Center, Dr. Thor Halfdannerson at Mayo Clinic, and Drs. Del Rivero and Dr. Hernandez at the National Institute of Health. As NET patients, we are so fortunate to have a variety of passionate and talented NET experts throughout the country. I can honestly say that every single NET expert I met expressed excitement and passion for treating and researching this disease and making the lives of NET patients better. These doctors have been humble and willing to work together on my behalf and have been respectful and empowering to me as a NET patient. I've been really blown away by how patient-centered and compassionate the community of NET experts are. However, I ultimately did have to make a decision about where I would receive the majority of my care. Some of my main considerations were expertise and contributions to research, the toxicity and quality of life impacts of potential treatment plans, and their research-based outcome measures. Also, logistics and ease of access to care were very important to me, and feeling welcome to advocate for my care and preferences and concerns was also vital. Because I live in a rural area and do not have access to a NET expert in my state, one big part of my treatment decisions was being able to do virtual appointments with my providers. Additionally, when it comes to surgery, while not a must, I was looking for an experienced surgeon within driving range. Ultimately, I ended up deciding to have my surgery at the National Institute of Health in Bethesda, Maryland, with Dr. Hernandez. Dr. Del Rivero there is helping navigate my care, and they are working hand in hand with Dr. Thor Halfdannerson at Mayo Clinic as well. I am so fortunate to be able to have this caliber of experts so highly involved in my care. But every doctor I saw through the consultation process made a difference in educating me and helping me better define what I wanted and needed and prioritized as a patient. If I could give advice to a newly diagnosed NET patient, probably one of the first things I would say would be, hold your horses. I know that getting this diagnosis can feel so overwhelming, but please know that there is so much hope with this disease. There are doctors and medical professionals who are passionately working to treat and research this disease. If you look back over just the last 5 to 10 years, there have been so many breakthroughs in treatments and diagnostic tools for NET. The community of NET advocates available to you are ready and able to connect you with the resources you need to find hope and empowerment. There are fellow NET patients who are available to mentor you and share their journeys with this disease, and many of their journeys are so inspiring and hope-giving. I personally was connected with a NET mentor who, like me, was diagnosed when her children were very young. 20 years later, she has seen children get married, graduate from graduate school, and she's even met her first grandchild. That gives me so much hope. It is hard to tell what research and treatment breakthroughs will become available to us as NET patients in the next 5 to 10 years. When I look back over this first year as a NET patient, I can honestly say it's not been that bad. There's been some hard days and some sad days, of course, but there's been so many happy days and so much hope. As I imagine where I'll be 10 years from now, I imagine that I might be saying the same thing. It's not been so bad. Maybe I'll say it's been so much better than I expected. If you're newly diagnosed, please know that there are so many reasons to hope for enough time, and so many people within the NET community working passionately on our behalf to create new reasons to hope every day.